Your follow-up after a kidney transplant is a team effort. You're part of the team. We depend on you to let us know if there are any problems and to be part of your follow-up care. The other members of the team, of course, will be our entire transplant team here, our nurse coordinators that will be in touch with you regarding any problems or changes in your medications, the transplant surgeons that did your operation, and of course your nephrologist that was taking care of you while you were on dialysis or while your kidney disease was being initially diagnosed. They remain vital members of the team for your care. And the longer you have the transplant, kind of the simpler the follow-up gets. When you're initially discharged, we'll have you on a fairly tight leash with some laboratory studies a couple of times a week for the first 4 to 6 weeks after transplant, so we can be sure your medication levels are satisfactory. Those surveillance laboratory studies, as we term them, will be extended to less frequent intervals, eventually to monthly or quarterly a lab test. You'll have an appointment back in the transplant surgery clinic about 2 weeks after your transplant, so we can be sure everything is healing well. And you'll have an appointment with one of your nephrologists about a week after you go home. Once you're at home, we encourage you to be up and around, to do a little walking, some light exercise. Don't overdo it. If you do, your incision will remind you to slow down. Usually patients are able to drive a couple of weeks after they go home. Once they don't have any narcotic requirement, you're able to wear your seat belt and put on brakes normally. You can begin to be out and about a little bit more. We'll also see you back at about 6 weeks and we'll arrange to have a small stent removed that was left in to help facilitate the drainage of the urine from the kidney to the bladder. After that, your follow-up becomes more lengthy with us, although we will continue to monitor your laboratory studies. But basically 2 weeks, 6 weeks, 3 months, 6 months, 9 months, 1 year, 18 months, 2 years, and every year after that is kind of the schedule you'll have with us. Our follow-up for out-of-town patients is coordinated with their local physician to avoid repeat trips to San Antonio. Most of this can be done through good communication with our staff and with the patient's local physicians. Of course, if there are problems, we're happy to see the patients back at any time, but we certainly understand the problems that can be involved with travel. Also, we have our satellite clinic operations in McAllen, Corpus Christi, Temple, Texas, Lubbock, Texas, and we see patients from those areas in our satellite clinics for the majority of their follow-up care. So we're conscious of the needs of patients from out of town. They make up a large proportion of patients that we see here at the Transplant Institute, and we make accommodation for that accordingly so that they can avoid travel and difficulties with follow-up.